Now we want to go to Washington, where Ben Tracy is standing by. Ben, an awful lot of number of people filing for unemployment. In fact, we don't really even know how many because, you know, in a number of states, the unemployment systems, especially Florida, basically jammed up and they weren't able to actually process the claims properly. So the numbers may be actually higher than what we're seeing right now. What's the message coming from the White House to all those people who have lost their jobs because of this pandemic?
Well, White House economic advisors have basically said the numbers are the numbers. And what they mean by that is they don't feel like there is anything they can really do about it at this point, that these numbers are bad. There's no way to sugarcoat that. People are losing their jobs because most parts of the country are now shut down. To put these numbers into context, we're talking about nearly 17 million jobs in the past 3 weeks. It took from 2009 to 2020 to create 20 million jobs in this country after the Great Recession. So almost all of those have been wiped out in just the past 3 weeks. Now, the difference this time is once things do reopen, you would assume that a lot of those jobs will come back and could come back fairly quickly. The president is counting on that. He keeps saying that things will bounce right back and take off like a rocket ship. But there are some economists who are saying it's probably not going to work out that well, that we are in for a recession. It could be deep and it could be long.
To that point, Ben, on CBS this morning, Gayle King interviewed the head of Goldman Sachs, and she asked about that, about getting people back to work, about reopening the economy. I know the president has been keen to do that, and I'm certain that there are a lot of Americans who would also like to get back to work. But it's not as simple as just turning on a light switch and all of a sudden one day we're in the midst of the pandemic and the next day it's contained and everybody goes back to work. There are various stages, as reported by our Catherine Watson, that would have to mean that different parts of the country open up at different times. And ultimately, the reopening of the country, in other words, getting people back to work, getting businesses, for example, CBS News, back into the broadcast center, isn't really up to the president of the United States. Isn't it up to the governors?
Yeah, exactly. The president did not flick the off switch. Governors did that, so it's up to them to turn it back on. And you are exactly right. This is unlikely going to go the way the president keeps saying that he would like to reopen the country with a big bang. This is likely going to be state by state and even within states, city by city. It all depends on where these cases have flatlined and where they're still growing. But more than that, it's also about how much monitoring and testing is going on in the country, because unless you really can test most Americans and unless you can really monitor those Americans who had tested positive and their contacts, you can't really safely say, yeah, go ahead and open all those restaurants on this street, because you just don't know who's going to be going into them. And we could be right back in this same situation a month later if they do it too soon. So that is the warning from the health officials. The president, of course, wants to get things open as quickly as possible. He wants to get people back to work, and he wants to see the economy start humming along again.
And now we're hearing some reports that the president may be announcing a second coronavirus task force, this one specifically to deal with the economic impact of the pandemic.
Yeah, the president's been asked about this a lot. It's something that he says he's going to do. He wants kind of two tracks here, to have the coronavirus task force, which is dealing with the nitty-gritty of how to get supplies to states. It's dealing with the data of where we're at on infections and hospitalizations and deaths. But he wants this second track of really led by the economic team to say, okay, so once we can reopen the country, what does that look like? How do we get people back to work quickly? How do we make sure it's safe? How do we help businesses stay afloat in the meantime, especially when it comes to these unemployment numbers? I mean, these numbers are just astounding. There is no way to really put them in full perspective that we have lost that many jobs in just 3 weeks. And as you've said, it's not going to be as simple as saying, okay, everything's open again, all those jobs will come back. It's going to be done in stages.
Ben, let me ask you about this. The CDC is now changing its guidelines for essential workers who have been exposed to the coronavirus. I think for a lot of Americans, Ben, as you break these changes down, it's going to sound very confusing. What are the changes and why is the CDC doing it?
Let's start with why they're doing it. They're doing it because they want to get these critical workers back to work as quickly as possible. These are healthcare workers. These are first responders. These are people who work in the food supply system here in the country. And so basically what what has happened is if one of those people had been exposed to somebody with coronavirus, they would then be required to stay at home for 14 days to quarantine, even if they weren't showing any symptoms themselves. What the CDC is now saying is if you have been exposed to somebody with coronavirus or a presumed positive person, but you are not showing any symptoms of coronavirus, you can now go back to work right away. But there are some things you need to do. You need to check your temperature every day before you go to work. You need to wear a face mask while you're at work. You need to practice social distancing. The question that we have now, and have not been able to get it answered yet, but we likely will today at the press briefing, is if 25% of people who have coronavirus in this country are asymptomatic, and that number could go as high as 50%, according to Dr. Fauci, how do you know that these people you're sending back to work don't actually have it and are not spreading it to other people? So this could be a situation where they're just willing to take that risk because they need these people that badly, but that question has yet to be answered.
Yeah, I really hope you get an answer to that question because, like Vlad said, we are hearing all kinds of information over the past few weeks, but we have been hearing about people who are asymptomatic but could be super spreaders, as they say, whatever that means. So hopefully we get some clarification. I want to ask you about something that came up in last night's briefing. Dr. Deborah Birx called for more testing using a specific type of rapid testing. Are there any plans to maybe roll that out a little more widely in the country?
They are hoping to do that as quickly as possible. What she was talking about last night are these Abbott lab machines. It's called the M2000. If you've ever had a strep test, this is basically what your sample goes into, and they've apparently can reconfigure these pretty quickly to run coronavirus tests. What Dr. Birx was saying is that these machines exist in laboratories all over this country right now, and they're not being used. She says in the past 3 weeks, they have only tested 88,000 test kits out of 1 million that they've put out there. And she said if all of these machines were being used, they could essentially test every health worker in this country within a week. So she got on the phone last night at about 8 o'clock, right after the briefing here at the White House, had a conference call with the managers of these labs to say, how many machines do you got? Plug them in, let's get going. And she did say that the vice president told her if that didn't work, that the president then would talk to the heads of these corporations that own these labs and kind of give them a kick in the pants to get these machines moving.
All right. Ben Tracy for us at the White House. Ben, thank you very much. Safety to you and your crew. We appreciate it.